Space research gives birth to new ultrasound tools for healthcare in orbit and on Earth. Diagnostic ultrasound is used at the International Space Station to monitor the astronauts' health and also to record the impact of microgravity upon their physiological systems. Working and living in a different environment causes our bodies to react differently. The simplest analogy I can think of is when someone goes to sea and they have to get their sea legs because the vestibular system is impacted. The vestibular system is also impacted when we go to space. The vestibular system has to do with our orientation and our feeling of up, down, right, left, and vertigo. Astronauts commonly take a few days to get their sea legs when they're at the International Space Station. Spaceflight and the duration of spaceflight has an effect on the human body system. Since the orbiting lab doesn't have X-ray and MRI machines and does have ultrasound gear, NASA hoped ultrasound's reach could be extended a bit. 2 decades ago in the International Space Station, NASA began to experiment with evolving ultrasound and its diagnostic uses in space. These have become primary uses on Earth as well. The NASA Advanced Diagnostic Ultrasound and Microgravity, or ADIUM research team, based at the Johnson Space Center, tests novel uses of ultrasound in large medical facilities and laboratory conditions, and then adjusts them for use in spaceflight. Investigators found that it is possible to use non-medical operators to obtain good quality data if the right clinical questions are asked and the operator is given the right amount and type of information and direction from a remotely located expert. What we are seeing is actually extreme telemedicine. NASA helped turn the station's ultrasound machine into an all-purpose diagnostic imager with a direct line to doctors on Earth. Using remote guidance, a sonographer views real-time ultrasound images on the ground and directs the in-flight crew member scanner on how to adjust the placement of the probe and to improve the image. The astronauts do have minimal training before they go into space, and in space they have the support of a complete set of e-learning tools, ultrasound cue cards, and the coordination with the sonography specialists back on Earth. A color-coded overlay is installed on the ultrasound keyboard. It was designed to facilitate remote guidance during experiments. Astronauts do not need to understand the physics of ultrasound, but they do need to know how to actually utilize the equipment. This method significantly reduces pre-flight crew time training and at the same time produces better images for experiment or medical use. Ultrasound is among the fastest, safest, and most universal diagnostic methods ever invented. It provides much of the information that can be obtained by other modalities such as X-ray, CT, or MRI, and it is the only method to produce a real-time or live image that can be interpreted and or transmitted at the same time. To aid the astronauts in clinical situations, such as when there's an emergency, NASA has developed a complete ultrasound pocketbook, which shows step-by-step how to perform exams and to interpret the images. With on-the-ground guidance, the pocketbook and e-learning materials available aboard the International Space Station, the astronauts are competent in utilizing ultrasound for diagnostic purposes. In fact, adapting ultrasound to space has actually evolved the number of exams that can be done utilizing ultrasound. This slide allows us to look or take a peek into the ultrasound handbook for astronauts. In addition to normal medical procedures used with ultrasound, the astronauts also must record and document the effects of microgravity on the human body in space. Standardized ultrasound exams on each of the astronauts over a period of time gives us information that is invaluable. The astronauts are examined pre-flight, in-flight, and post-flight so that we can evaluate the effect of zero gravity on the human body. Here we can see a primary list of the exams that are performed in microgravity. They include cardiac, abdominal, retroperitoneal, GU, musculoskeletal, thyroid, dental, sinus, eye, and peripheral vascularity. Ultrasound is one of the most adaptable diagnostic imaging modalities, which can be used for many medical and surgical conditions. Advances in portability and affordability, coupled with the enhanced training programs and teleultrasound, can provide powerful diagnostic capabilities anywhere on and off the planet. This is Mark Struthers saying thanks for watching, and check our website medicalimagingtutorials.com for more video clips about medical imaging.